Hello, my name is Dr. Mahesh D M. I am a practicing endocrinologist at Aster CMI Hospital, Hebbal, Bengaluru. Many people come and ask, Doctor, I want to lose weight. Can you tell me anything new about the weight loss pill that has come? Many people are having fear that taking this medicine will have a lot of side effects. I will get some vision loss, or I will lose a lot of weight, I may look weak. And there are many patients who feel that if I start this medicine, what will happen? Shall I take? What will happen long term? What are the side effects? So there are many myths and misconceptions about these medicines that are recently available in India. They are mainly available as two injection form that have come for weight loss. One is known as the semaglutide, the other is tirzepatide. So let us briefly discuss about both the molecules that are available today for weight loss. They are new in the market in India, but they have been available outside India for quite some time. So we have information about these molecules that are there for the last 3 to 5 years, or even more than that in some countries. So what do we know about these drugs? The most important question is, am I qualified to take the drug? What if I take this drug? What will happen to me? Who are the people who are selected for these drugs? Can all people take these medicines? So there are many questions that come to the mind. So I will be briefly dwelling about both the molecules so that we can make a rational choice in consultation with your doctor, which is very important. These are not over the counter drugs, not everybody should take it. So let me briefly deal with both the molecules. So what are the indications? Which patients are eligible for these molecules? In Asian Indians, especially the Indians, if the body mass index BMI is more than 27.5 kg per meter square with comorbidities, especially diabetes, hypertension, fatty liver, or some patients have osteoarthritis knee, or they have many different problems that come together. They may have even a recent cardiac illness also. So that makes them difficult to follow a very strict lifestyle. So these patients with obesity and comorbidities do qualify for taking this drug, but which drug, when to start, depends on the conversation you will have with your doctor for the appropriate dosage. The second group that we do start these medicines are patients who do not lose weight despite following strict diet, low calorie diet and regular exercises, and have a less stressful life with a regular sleep pattern. In those patients with a BMI of more than 30, we do consider these medicines for them. So do we start them immediately? No, we do discuss with the patient and decide who is qualified. So let me tell briefly about the two drugs. First one is semaglutide. It is available as an injectable form. It starts from 0.25 milligram per week and gradually escalated every 4 weeks to the highest dose of 2.4 milligram. So 0.25 first month, 0.5 second month, 1 mg third month, then 1.7 mg fourth month and 2.4 mg fifth month, if they tolerate these medicines as we are escalating the dose. Some patients do not tolerate, they may have nausea, vomiting, gastrointestinal side effects. Then definitely we either reduce the dose or we change it, discussing with the patient. But the optimal dose is somewhere between 1 mg to 2.4 mg depending on the patient and how they respond. When it comes to the other drug, tirzepatide, it starts with 2.5 mg. That also is gradually increased every 4 weeks to up to 15 mg depending on the type of patient and their comorbidities. The common side effects are again nausea, vomiting and sometimes loose motions. But there are two important cautions. Patients with pancreatitis who have had a pancreatic attack, we do not start these medicines. The second group is anybody with family history of medullary thyroid cancer or a history of thyroid cancer, we definitely do not start this medicine. Otherwise, these medicines are safe in a given set of patients who really deserve this to change the course of their comorbidities in order to lose weight, and in those patients who despite lifestyle modification are not able to lose weight. This is in brief about these two newer molecules that have just come to India in the last few months. For more questions, you can always consult your doctor and get the right appropriate answer.